If you're looking around for a therapist, you're going to want to stick around because today we're going to talk about 3 questions you should ask any potential therapist. Welcome back, and if you haven't been here before, my name is Matt. I'm a therapist at Progress, a small group practice located in New York City, treating issues like ADHD, anxiety, depression, and some others. So before we jump into the 3 questions you should ask any potential therapist, we have to talk about the reason for asking these questions. Now, if you're looking for a therapist, you're usually looking to make sure this person can help you with the issues that you're coming to therapy for, right? So if you're coming to therapy for anxiety management, you're going to want to make sure this person has some experience in anxiety management, right? If you're coming for depression, same thing. You want to make sure that person has some experience or training in interventions that can help you with depression. You also want to make sure that the person is a good fit for you personality-wise, right? So are they someone that you can speak to, someone you feel comfortable with? These are not so much skills, but these are characteristics or personality traits that you might be looking for. Now, these 3 questions that we're going to go through, because they're going to get to the root of what the therapist's clinical training is, what their background is, what kind of experience they have, and some other things. So when we think about these 3 questions, the whole point of these questions is to see if this therapist is going to be a good fit for you, not just personality-wise, but also can they help you with the issues that you're going to therapy for. These are all important things that we need to make sure of. All that to be said, there's no perfect formula for finding the right therapist. What we can do is do our best to see if they're a good fit on the initial phone consultation. After that, we do have to kind of let time play out and to see if they really are a good fit. However, these questions should give you a really good starting point. Oh yes, and the questions we're going to go through today, they don't need to be asked in any specific order. We're just going to go through the questions. Oh, and we're not only going to go through the questions that you should ask, but I'm also going to tell you how you can interpret the therapist's response. So when they share something back after you ask them, what does it mean? How do you understand it? And that's what we're also going to talk about today. All right, let's get started. So in searching for a therapist, I think it would be helpful to ask them how they would describe their therapy style. When you ask a therapist what their therapy style is, you're basically asking them what their approach to therapy is. And when they start to describe their approach to you, they're going to share with you a couple things most likely. Probably going to describe to you what their theoretical orientation is. This would be something like psychoanalytic or behavioral. And these psychological orientations, they're not made up, but these are schools of thought that have been developed over time. So for example, something like psychoanalysis, this would have its roots with Freud, right? Sigmund Freud. Most people have heard of him. Psychoanalysis is going to have its roots there. So if someone says that they're psychoanalytical or they practice from a psychoanalytic approach, you know that they kind of come from that school of thought, or that's a school of thought that resonates with them, right? And there's so many others. What kind of orientation the therapist resonates with. And another thing a therapist might start to describe to you when you ask them about their style, they might start to describe their personal style of therapy. Now, as any provider, whether you're a doctor or a therapist or a physical therapist, you develop your own style. This is different than a theoretical orientation or interventions that you might be trained in, but every provider has their own unique personality, their own unique attributes. And in that regard, there's always going to be a slight difference in how one therapist practices from another. So for example, when I speak to potential clients, I always talk about how I like to be goal-driven. Goal-driven is not an intervention, but it's a style that I kind of practice in, and it's something I've developed over time throughout my career. So when someone asks me, I say, yes, I practice from a goal-driven approach, and I also use evidence-based interventions like CBT and DBT. And this personal style is probably going to come from a mixture of personality, training, work experience, this kind of thing. So then as the therapist answers this question about their therapy style, how are you, the potential client, supposed to understand this? Well, first, if they start to describe their theoretical orientation, right? Or if they talk about the behavioral approach, or if they talk about family systems, you want to do just a little Google search to see if that theoretical orientation is something that you might resonate with as well. Secondly, as they start to describe their own personal style, right? So for me, for example, when I talk about being goal-driven, if a client really wants to work towards concrete goals, then they might think, yeah, this would be a good fit, right? But if you're someone who doesn't have clear goals in mind, or working on goals is really not something that resonates with you, then you would know that maybe another therapist might be a better fit. But at the end of the day, you want to see if the therapist's response and what they're sharing with you resonates with your own intentions for being in therapy, right? And you might have to do a little bit of research after talking to the therapist based off what they share with you. And And then this next question, it's actually a cluster of questions that I might ask, is somewhat related to the first question we just went through. I would ask someone what they have training in, where they did their training, and how they continue to educate themselves now. Now let's break this down a little bit. Now, when you're asking a therapist about what kind of trainings they've gone through, you're starting to learn more about which practices or which interventions they have formal training in. If a therapist says that they do CBT, right, cognitive behavioral therapy, this is a very popular evidence-based intervention at the moment, you might want to know, have they had training in CBT? Now, that being said, not every therapist is going to have years and years of experience. There is going to be some therapists who are in the middle of their training. Maybe they're being supervised. But at the end of the day, I think it's important to know that your therapist is at least being trained or has gone through formal trainings in the interventions that they say they are using. And now the reason why I would ask where they were trained or how long they were trained is because there are a whole range of trainings. You can do a simple online introductory course that's an hour long in CBT. You can also sign up for very intense, extensive trainings. So there's a huge span of trainings that someone could have, right? So for example, someone who has the 1 hour introductory training and someone who has the year-long intensive training, they could both technically say that they have some training in CBT. So I think it's important to not just take that at face value, but to also ask, where was the training? How long was it? What's your training in? And in this way, we are starting to get to what the therapist has formal training in, which obviously is very important. Now, a quick caveat, some therapists, well, actually all therapists at some point are in the beginning stages of their training. This is not to write those therapists off. In fact, the therapists in the midst of their training are often the ones asking questions constantly. They actually need supervision, so they're being supervised. There's a lot of accountability there. A lot of therapists in training are very good, are very promising clinicians with a lot of accountability. So just because a therapist is in the midst of their training and might not have years and years of experience does not mean you should write them off. And another thing about the trainings, you might want to ask if the interventions the therapist is trained in are evidence-based, right? So some examples of evidence-based trainings would be CBT and DBT. And that's not to say that only evidence-based treatments are effective. There are a lot of treatments that work well that are not evidence-based yet. So again, this is not a question to write it off, but it is helpful to know whether or not the interventions are evidence-based. So then how do we interpret the answers that a therapist might give? Once again, a therapist is going to begin to describe to you some of the interventions they have training in, right? So again, CBT, DBT. You can stop them and say, hey, what does CBT mean? Can you give me a bit of a brief background on what that is? Or DBT, what exactly is that? Can you give me a little bit of a background on that as well, right? So I think these questions are going to provide more information. You're going to get more information from the therapist, and then you can ask them to clarify a little bit, or if you're short on time, you can do a little bit more research to learn exactly what those interventions are. Now, you don't need to fully grasp the concepts. Like, you don't really need to know all about DBT to understand whether or not it might be helpful for you. Just a quick Google search might help you decide that. But at the end of the day, you're at least going to have that information when you ask these questions, right? And then it's pretty self-explanatory. If a therapist is saying they're in the middle of training and they're being supervised, well, then you know that this therapist doesn't have years of experience, but yet they are being supervised. So there's a lot of accountability there, hopefully. They also probably have access to someone who is really experienced that they're talking to and that they're working with. So that's something to consider as well. And then if someone responds to you that they've done, a couple day-long trainings in CBT, you know that perhaps they don't have the most robust training versus someone who says that they've completed, extensive training at some sort of institute and has a certificate to show for it. Again, none of this is make or break, but it gives you more information to determine whether or not you feel this therapist could be a good fit for you and the needs you're looking to meet. And then finally, I would ask a therapist how they stay accountable. We're basically asking a therapist how they uphold ethical and clinical standards in their practice. Now, if you see a therapist at a local hospital clinic or a big outpatient setting or some sort of agency, there's typically accountability built in, right? So the therapist most likely has a supervisor, that supervisor has a boss. So there's a lot of checks and balances in place to make sure ethical and clinical guidelines are being upheld. Now, in private practice, this is not always the case. Sometimes it's a solo practice. And in that case, how is this therapist staying accountable and making sure that they follow ethical and clinical guidelines? Now, it might not be accountability the same way the hospital has accountability, but perhaps they're part of a consultation group, or maybe they are actually part of a group practice where there's team meetings and there is a supervisor, you're just not aware of it. At the end of the day, though, I think it's important for any provider to be accountable, to make sure that they follow all the ethical and clinical guidelines. And I think this is a very fair question to ask. And then how do we interpret their response? There's a lot of different answers people might have. At the end of the day, I think what you really want to look for is that there's something in place for a therapist to be accountable, other than just themselves, right? That doesn't work very well. And so I would think that any therapist that has some sort of accountability set up, that would be a good thing. And again, very fair for you to ask. So those are 3 questions you might want to ask a potential therapist. I think it helps you gather a lot more information that can really help you decide whether or not this therapist can be a good fit. Anyway, I hope this was helpful for you. I hope you learned something. And until next time, we look forward to seeing you soon.